I want to welcome you guys to the Cancer Project podcast. We're really excited today to be joined by Jennifer Watkins. She is the Chronic Disease Coordinator for the Oklahoma Department of Health. And she and her team are leading a broad spectrum of initiatives dealing with things like arthritis, tobacco use, and cancer. And that's a lot of what we're going to talk about today here on the Cancer Project podcast. So Jennifer, thank you so much for joining us.
Thank you for having me.
First, I think we should get to know you as a person, and then Annie too.
Yes,
you have Annie,
the star of my show.
Yeah, your English bulldog here, super cute, really well behaved too. So tell us a little bit about just kind of your background and how you ended up working for the Department of Health here in Oklahoma.
Yeah. So cancer kind of came into my life when I was 11 years old, sitting there waiting for the school bus, and I found out my mom was diagnosed with breast cancer. About 2 years later, on July 4th, she passed away from cancer. So it definitely changed the image of freedom to me, but it gave me a purpose of kind of the rest of my life. I started out working for the American Cancer Society right out of college, and then I worked for the National Cancer Institute, MD Anderson, different things. So I really had some really solid cancer connections through that. And my goal was just to make sure no one else went through what my family did, and that my children would never go through that as well. So that really drove the cancer piece for me. So it's something I've always been in 25 years of professional career. And then, like we were talking earlier, about 10 years ago, I lost my dad to colorectal cancer too. So just knowing how these families feel when they don't always know where to get the answers really is what drives my work and everything. And having the opportunity to go back to the health department and make a difference was a great thing for me. And so I've been there about 3 years working with the coalition and working with CDC on things. So cancer is one of those things I think you can attest to that impacts everybody. I mean, just about everybody has a friend or a family member, or maybe it's them personally that have gone through cancer. So talk a little bit about, if as much as you're comfortable, what it was like for you as a child or a child of now two parents that had gone through cancer. What was it like for you personally? Back then, this was late 80s, and we didn't know what cancer really was. Oddly, I was from a very small town, and a couple of other girls whose moms had gone through cancer at the same time, we had a cheerleading coach that was able to connect us, and she would have lunch with us about once a month, and we would just talk. And that was kind of the first connection I had to the support of what families go through outside of my own family and our church. But so that really kind of helped me understand maybe what some of the families are going to go through. So working with ACS and, I've always been had that patient interaction. And so as much as you hate to have gone through it, and I hate that my mom went through it, knowing a little bit about what a family is going to need, I think definitely helped.
Well, it sounds like it changed the trajectory of your life because it kind of gave you this career path that you chose. So then what was maybe similar or different as you went through being a caretaker a second time for a parent with your dad?
It brought up a lot of those old feelings that you didn't really expect, but also kind of knowing a little bit about, okay, well, this is the connection we need to make, and this is who I need to talk to. I think that really helped the second time around, is knowing what questions to ask, and having the resources to be able to ask them was so critical. Like my dad actually went through treatment at the Proton Center, and I knew about it from my work with the coalition outside of my dad's treatment, but getting to see that firsthand and the patient care and the resources was an incredible opportunity as well.
Yeah, I think one of the things that we talk about at the Proton Center, and maybe you can comment on this, is that we want patients, we know we have great technology there. A proton machine is the most sophisticated medical device that's ever been made. So we can do some incredible things clinically, but there's also there's a human element, and there's a psychosocial element, and there's a mental health aspect to going through treatment. And so we want patients that come to the Proton Center to have the best healthcare experience that they can possibly have, even as they navigate something as difficult or traumatic as cancer. So maybe talk a little bit about just the importance of the care that exists outside of just the treatment itself.
Oh, absolutely. And I think it does have to be that holistic approach because your 10 or 15 minutes with your physician, you can't get all your questions answered. It's not possible. So having the big picture approach of having a patient navigator or a social worker or somebody that can help you understand what your insurance options are and what your rights are is incredible. We have kicked off a Cancer Survivorship Series called Beyond the Diagnosis. And yesterday was financial toxicity, and we brought in an attorney who specializes in cancer legal matters.
Okay.
And so she was able to walk our participants on, and we'll share the recording to access those resources. But she was really able to share, these are what your rights are, and these are the questions you're allowed to ask. And when you're so worried about the financial aspect of it, this is what you need to know, that you have absolute rights. And it shouldn't be a terrifying experience from every angle, because I think it can be. You're worried about your own mortality, but you're also worried about, can I put food on the table? Can I feed my kids or my family? Do I pay medication or electric bill? So helping address some of those issues was wonderful to have. We're also looking at some of the social and emotional aspects of physical activity and nutrition. What food is going to be the best to help your body heal and make the treatment most effective? How can you get the most physical activity so that your body feels good when it's at its lowest?
Right.
We're also doing a session that I'm really excited about because it was kind of the brainchild of a cancer survivor story, and it's uncomfortable questions.
Okay.
Once you're kind of through treatment and you're getting back into intimacy again, or your body is so different, the bowel movements are different and things that you didn't think about beforehand, but how to reconnect with your partner and have conversations. And again, those are some of the things that's very hard to fit into a treatment protocol, but are so healing in the big picture.
So I want to make sure I get these right, because I wrote down the titles of some of these sessions here. So you have let's see here. We've got financial toxicity, the other side effect.
Right.
So that's the one you just talked about.
Yes.
And I do want to talk about that more.
Absolutely.
Food, fitness, and fighting cancer. Some great alliteration there. The role of lifestyle in cancer treatment. Caring for the mind, suicide prevention, and emotional well-being in cancer, more than survival, the lasting journey of childhood and young adult cancer survivors, and then what you just talked about, unspoken questions, intimacy, and connection after cancer.
Right.
So going back, and so this is, just to give people some details, so these are every Wednesday.
Yes, every Wednesday at noon via Zoom. And like I said, these will all be recorded, so people that aren't able to participate, we will have them linked to our website. I'm happy to share those with you as well.
Okay, we'll put the link for those listening. We'll put the link in the comment section.
Yes, that absolutely works. And so, we've got a lot of information on our social media pages for the health department to be able to access that. But yeah, we really kind of, through talking to some of our survivors that are helping us really change the narrative, we kind of discovered that this is such a needed piece. And the more I talk to people even outside of Oklahoma, we're actually setting a trend for other states to be able to do this as well. So I had a conversation with Ohio yesterday, and she said, I never even thought of this.
Yeah.
And, so we've had that opportunity as well. But, like I said, the financial toxicity piece was, people just need to feel like they have some options, and that, it's not just, I can't even go through cancer treatment because I can't afford it. That's such an unfair feeling.
What are some resources that people should think about? So, and I want to step back and kind of lay some groundwork of things that we've observed at the Proton Center. I read a stat one time that suggested that over 50% of patients that go through cancer treatment end treatment in some type of debt. And that may be because of the treatment itself. It may be because of they're out of work. Caretakers are having to be out of work.
Yeah.
Maybe they're having to travel. There's certainly a lot of expenses, even beyond just the treatment itself, that you experience going through something like a cancer diagnosis. And so it is a reality for people. And of course, there's the question of, is my insurance going to pay for treatment? And I've got a deductible, and then the deductible is going to reset at the end of the year, so I have to pay the deductible again. And that's a lot to think about. And so as an example, we have a foundation called the Proton Pals Foundation that steps in and helps patients deal with some of those costs that are not covered by insurance.
Yeah.
But what are some other resources that people should be thinking about as they're wondering, how do I pay for everything as I'm going through cancer treatment?
That's a great question. And finding the actual dollars can be very difficult. But the organization that we partnered with yesterday is a national organization called Triage Cancer.
Okay.
And they are incredible. It was founded by 2 attorneys, and they saw the need for cancer patients and survivors and family members to have access to the legal support of cancer. So with every session that we do, we have a survivor tell their story.
Okay.
So that it kind of gives a face to the story and people can see a connection. And so the man that we had yesterday, and he lets me tell his story. So, but his name is Curtis, and he actually worked in insurance before he was diagnosed with prostate cancer. And he realized that, like a lot of us, our insurance is tied to our jobs. And when he didn't have the strength or the stamina to keep up with his job, he lost his job and he lost his insurance just as he was diagnosed with prostate cancer.
Yeah.
And he said, I had a little bit of savings, but it doesn't go very far with treatment. And so, he told his story yesterday, and it was so impactful because it really is the real life picture of the human side of all of this. So working with Triage Cancer, they have attorneys that you can actually connect with, which is fantastic. There's a simple form on their website that you can go in and kind of start the conversation, and then they connect you. But they also have resources and worksheets and guides to kind of help you walk through the financial side and, the tips of look at this bill, but wait for the EOB, and, have those kinds of things where you're not, well, I paid this bill, but then I didn't have to, and those different things. So it was such a great tool, and everybody on the call, they were just amazed, we want to access this. And so it was a really great thing to be able to work with them as well, and see what's available.
Right.
And so,
The one of the things that we talk to our patients about and is don't be afraid to bring up the fact that you have a financial burden or this financial toxicity. I can probably speak for all of the big cancer centers here in Oklahoma City, SSM Health, Mercy, OU, and ourselves and Integris. All of these cancer centers want to help patients get through treatment, and they all have teams and resources that are designed to help patients, even if it's something as simple as, can I have a payment plan for this bill?
Right.
Or is there a way to possibly have a charitable discount for the bill, a needs-based charitable discount? Those are things that exist, but sometimes it is imperative for the patient to take the first step and ask, but that's so hard. It's so hard to just admit that.
Yeah. And, when you've just kind of been told one of the biggest life changes right then, you're still trying to process your diagnosis and not all of the other things. So, taking a minute and being able to ask those questions of, is there an option? What can I do? And we've got some amazing centers here in Oklahoma and resources available. So feeling like you don't have to travel to put that extra burden on, I think is so important too.
Well, I think the Hope Lodge is a great example of that with the American Cancer Society, where patients traveling into Oklahoma City for treatment can stay there at a significantly discounted or free rate. And so that's an incredible resource that we have here in Oklahoma City. Not every city has a Hope Lodge like that.
Yeah. And I know how hard they worked. A friend of mine was kind of the lead on that. And I know everything she went through to get it here. And it was phenomenal to see that come to fruition.
So I want to bring up one of these other topics here, because I think that this is also something that it needs to be talked about. So in 2 weeks, you have a topic, caring for the mind, suicide prevention, and emotional well-being in cancer. Talk a little bit about why that is important and why that's a topic that you guys decided to cover.
And I think it's one of those topics that is hard to talk about. Yeah. So, why don't we start the conversation was how that one really came about. That, there's such a need, and sometimes there's a stigma on that feeling of mental health and hopelessness. Mm-hmm. And so we wanted to start the conversation, again, have a survivor tell their story of how difficult it was to kind of come to terms with everything and just the changes that they're going through. So that was really what kind of created that topic. And that was one of the, main topics behind this whole series was this is important. And so we want to cover that. And so knowing that the risk of suicide because of depression and hopelessness can be so high in cancer patients, survivors, caregivers, because they feel alone and they don't know who to talk to or how to talk about it. The medication may just make their brain feel very foggy, and so they're also not in the best headspace as well. So having an outlet for them to talk to, providing resources for them, I think is going to be so critical to really support them. He's one of our team members at the health department, and he does a great job on the mental health aspect. And so he's going to help us with that series as well.
I'm glad you mentioned caregivers too, because one of the things that we see is, of course, everybody thinks about the patient and what the patient's going through, and there's going to be dark days, there's going to be physically challenging days, mentally difficult days. But it also can take a toll on spouses, on kids, on parents. And one of the things you mentioned was just that conversations about intimacy. Well, mental health and intimacy can kind of go hand in hand.
Yes.
And just getting through as a caregiver some dark times. And we've just seen too many times where a marriage falls apart or, there's conflict within the family or difficulties within the family because of this catastrophic disruption that can happen with cancer. So I would say, it's not what you're talking about. It's not just for the patients. It's for anybody involved in the care.
Absolutely. And, sometimes, and obviously I've only been the caregiver in this situation rather than the patient, but the patient, there's active treatment, there's active things. And we do hear about, once they're done with treatment, the fear of recurrence because they're not actively treating it. But for the caregiver, there's not active treatment. They're just trying to support. Well, who is supporting them? Who is there for them? And so having that piece too, I've had some conversations with people, and her husband is the one going through treatment, and I said, join both of you. I would love to see both of you on there so that you get your own piece. And I would love to see this series be able to break out. And, we have kind of a track for survivors and we have a track for the caregivers so that they can talk to, in an open space, just kind of to people who have been through it with them.
So tell me, who are some of the other, so you mentioned this triage group that was the presenter for the first episode. Who were some of the other presenters that you have lined up?
So next week we will have the YMCA who will kind of handle the fitness piece. And then we will have the dietitian oncologist from OU. Okay. And we're really excited about that because I think that's one of the least understood aspects of direct treatment is, you don't feel like eating and you don't feel like anything, but you've got to get enough calories for your body to be strong enough to fight this and work with the medication you're taking. So just having that, also having the resources of knowing if I'm trying to pay for treatment, I can't afford good food.
Right.
So where can I access food and what can I do there? And how can I find the best, kind of connection to make my situation as good as possible?
Right. So I want to pivot a little bit and talk about the Oklahoma Comprehensive Cancer Network.
Yes.
So more broadly, I mean, this is an initiative
Right.
of that. So I'm going to read this. This is from the website. Okay. The purpose of the Oklahoma Comprehensive Cancer Network is to continually develop, implement, evaluate, and update the Cancer Prevention and Control Plan for the Oklahoma State Cancer Plan. And when did the Oklahoma State Cancer Plan first get published?
So this coalition and kind of the cancer focus actually started, the idea came about in about 2000, and then about 2004 was when efforts really started growing on this. So it has been around 21 years or 22 years now, and it has just grown. It's got some amazing partners. We have about 40 organizations that participate. The ones you typically think of, the health centers and the cancer centers and, American Cancer Society, but we also have local programs, survivorship groups that have joined, just individuals who are interested. So it's been a really great thing. Our kind of primary focuses are primary prevention. So how do we prevent or at least reduce the risk of cancer? Screening and early detection, what cancers can be really screened for and how's the best way to address that, and then survivorship.
Okay. So we'll take each of those three.
Yeah.
So cancer prevention, I mean, that's something that I think a lot of people would love to know about.
Yes.
So you can actually reduce your risk of cancer.
You can, and risk reduction is really the most important piece to it because it's very hard to totally, prevent cancer.
Right.
But by doing the things, eating well, being physically fit, having, a lower body weight, obviously don't smoke, don't be around commercial tobacco, and then also vaccinations. So the HPV vaccine is very important as well. Yeah,
I think it's Scotland or Ireland. I can't remember which country, but one of the countries in the UK has almost completely eliminated cervical cancer,
right?
Or HPV related cervical cancer.
And that's one of the most exciting things. We have a doctor at OU who is so passionate about it, and sometimes we just stand back and watch her work because she is amazing. But knowing that you really can reduce the risk of preventative cancers, such the ones that are tied to HPV through a vaccine, and it can be scary, I know, thinking about a vaccine that you don't fully understand, but it's such a great resource to be able to truly reduce cancer risk.
What is the state's role in this? I mean, why is this an initiative? Because this is taxpayer dollars funding this.
Well, yeah.
So why is this important for the state?
It's actually a cooperative agreement through the CDC. And so most states across the U.S. have these types of cancer programs and plans, and also a few of the tribes. So Cherokee Nation also has a cancer plan like this, and we partner on pretty much everything with them. But I think it's really important because it's really not a competitive thing when we can pull everyone together. Everyone wants their patients to succeed and they want their programs to succeed. But if we can pull people together and say, hey, here's some great things going on in breast cancer. So let's look at what they're doing, and maybe that evidence translates to another program. So just having everybody on the same page, we're all speaking the same language. The message is very consistent out there, definitely helps.
I think one of the things that's been helpful for us as a provider, as a clinical provider at the Proton Center, is to just hear what other centers are doing.
Absolutely.
I mean, in a sense, you are serving as this facilitator to bring people together to share ideas.
Yes. Yeah. And I always think back to so many people, for a while, it felt like, okay, I was diagnosed with breast cancer, I have to go to MD Anderson because everybody knows it. And MD Anderson is wonderful. Yep. But to understand that MD Anderson is communicating with OU and with the Proton Center and those kinds of things. And so the research and the successes and the survivor stories that are being created across the country come to Oklahoma, and Oklahomans get access to that, and we are all able to communicate with each other and access as well has been so valuable.
Yeah, we tell patients that come to the Proton Center, protons are protons, whether they're at MD Anderson
Yes.
or at Oklahoma Proton Center. They're going to act the same way. They're going to go in, they're going to damage DNA, they're going to stop inside the tumor. We both use particle accelerators. We use the same treatment planning systems. We use the same treatment protocols. So you're right. There's a lot of, I don't think people realize the caliber of cancer care that we have here in Oklahoma. It's very high quality. I do want to, so despite that though, our cancer mortality rates in Oklahoma are not great.
Right.
Depending on what year it is and which cancer you're looking at, we've tended to be towards the bottom of the state rankings nationally in terms of cancer mortalities, meaning if you get diagnosed with cancer, how long are you going to live after being diagnosed with that cancer, or how quickly are you going to succumb, or what percentage of people will pass away because of the cancer. So talk a little bit about why you think that is, and maybe what the coalition is doing to help address that.
That's a great question. And, definitely I came, like I said, from a small town. I grew up in the FFA. I understand that country, bootstraps, tough. You only go to the doctor when your finger's cut off kind of thing.
Right.
But I think understanding that, yes, going to the doctor is scary and you may not get the news that you want, but the sooner you go and you find out, your treatment outcomes are so much better. And so we can tremendously reduce mortality rates by early screenings, by following the guidelines at, no one wants a colonoscopy. It's not the funnest thing in the world. But if that could stop your cancer right there and you don't have to go through everything else, take a nap. That's kind of, and so we definitely want to encourage the early screenings and the health, because in Oklahoma, we really are tied to so many strong legacies. And you setting those strong examples for your family, for your community, really kind of creates that legacy as well. So get the early screenings, talk to the doctor, have the conversations. They're not always comfortable, but finding it early to reduce the long-term effects is so important, and that's really what will change our mortality rates.
What do you think? So do you think that so certainly a lack of screening or lack of early screening is probably the biggest cause of the cancer mortality issue that we have in Oklahoma. What do you think? I mean, you mentioned kind of a cultural component or element to that. Is there an access issue?
There definitely can be.
Issue?
Absolutely. And one of the great things that we're seeing are these mobile units that are starting to appear. There are some of the federally qualified health centers. They have some mobile units. OU has mobile units as well. And so we can partner. We can make sure that a community, Guyman has access to mammography screening and lung cancer screenings, because we can actually take the screening to them. And that is so important. Working with county health departments to understand what resources are there. Oklahoma, in the last year and a half, created the Oklahoma Lung Cancer Roundtable. And they actually have a website. And on that website is where you can go be screened for lung cancer. And they're all over the state. So, never feel like you have to drive to the city from Idabel or Woodward. There are resources. And so we really are addressing that access issue, because that can be a tough issue. Or if I don't have insurance. And so there are programs like Take Charge at the health department, or Project Woman, that will actually help with a screening and treatment. So
Oklahoma Project Woman for breast cancer screening. So Oklahoma Proton Center is partnered with the Premier Breast Health Institute down in South Oklahoma City. And we really love what Oklahoma Project Woman does as far as covering the cost for screening mammograms and ultrasounds and MRIs or whatever women need to go through breast cancer screening, and guys too, actually. There's about 1 to 2% of breast cancers actually present in men. So you talked about there's the lung cancer roundtable. What are some of the other, I guess, more prevalent cancers or big cancers that people should be thinking about screening for?
Well, and the ones that we primarily focus on, just based on data and everything, is the breast cancer, cervical cancer, colorectal cancer, lung, and prostate.
Okay.
So that's the ones that they're the highest incidence that we're seeing. They're the ones that we can have the biggest effect on. Obviously, they're not the only ones that are important.
Right.
But those are the ones that there are set screening and opportunities to catch it early. There's some great research going on right now in prostate cancer with at-home tests.
Yeah.
So men no longer necessarily have to go and have the uncomfortable doctor's appointment. So they're working on that. They're working on some communication things that help men understand how to make that happen. And then obviously the colorectal at-home test.
Yep.
Now, if you are high risk, like for instance, I am high risk because of my dad, I still need to go get my colonoscopy. Right. But average risk, you can do an at-home test.
Right.
And that's a great thing. We're also seeing that with cervical cancer. They're about to roll out, and there's a lot of research happening with an at-home cervical cancer test. So very exciting things that could really change the dynamics across Oklahoma
and make it easier for people to be able to do. I mean, there's a privacy component too with screening. I mean, a colonoscopy or a pap smear or a mammogram, none of that is fun personally to go through. So with lung cancer, then what should people be thinking about with screening? And I know you were part of the tobacco settlement trust for a period of time. So maybe talk a little bit about lung cancer and the tobacco trust and just kind of that dynamic in Oklahoma.
Oh, absolutely. And, I think I was around when the tobacco settlement happened and some great things. And Oklahoma was one of the only states that did such an amazing job with their tobacco settlement money by creating the Tobacco Settlement Endowment Trust.
Okay.
And they really set aside the money to help Oklahomans change the outcome on health. And so they've done a great job with that. They have really, tried to be responsible with that money and everything. They are really looking at how to help. But they established the Oklahoma Tobacco Helpline. And so anyone in Oklahoma can access that. They can get counseling. They can get help. There's different levels of the options that they have, but it's free for everyone. They can get the medication if they want to try the nicotine replacement therapies. So that's a great resource. But as far as lung cancer screening, the guidelines basically are 50 to 80 years old and having a 20-year pack year history.
Right.
So if you've smoked for more than 20 years, a pack a day, and you're 50 years old or older, then definitely you should talk to your doctor. You should see about the screening. Because again, like everything else, the sooner we can catch it, then the treatment outcomes are so much higher. The side effects aren't nearly as bad, mortality rates and everything. So piggybacking off that, we actually do low dose CT lung screening at the Proton Center. And we started that because we have a CT sim there. And of course we treat cancer, but that we have this great tool. And then if somebody ends up being diagnosed with cancer, they're right there in a cancer center. And one of the things that we discovered as we opened up this program 3 or 4 years ago was that you would have people come in and maybe they were 55 years old and they had 19 pack years of history instead of 20 pack years of history. So we established what we think is a very affordable cash pay rate, $250 to get the low dose CT lung screen. If you don't, because those parameters that you described, that does impact insurance coverage too, right? It
so
does,
insurance companies will say,
yeah.
well, you have to have these 20 pack years instead of, and so the definition for that, I know you know this, but for our listeners, a pack year is an average of 1 pack a day for a year, for 365 days. So if you smoke 2 packs a day for a year, that's actually 2 pack years.
Yes.
So if you smoke 2 packs a day for 10 years, then you are at 20 pack years. And so we think that that's very important. And I only bring that up to just let patients know that that's the type of scan that they should be thinking about.
Absolutely.
Is these low dose lung CTs. And a lot of facilities offer those. But if you're concerned about it and you're 49 and you have 20 pack years, or you're 52 and you have 19 pack years, don't necessarily say, well, I shouldn't get the scan.
Right.
There's options out there. And if it's something that you're concerned about, there's an opportunity at the Proton Center. And again, there's other facilities that'll do it for a reasonable cash pay rate as well. And I think that's like, again, this all kind of goes hand in hand with what you talked about with financial toxicity, because the take home screening tests. I think we're right on the precipice of really being able to do some just incredible things in terms of at-home cancer detection. But those tests are expensive. And a lot of times those tests aren't covered by insurance. And so that'll be something to think about as we go forward. Is how do you create access to that?
Yeah.
So what else should people know just about the resources available for lung cancer? I mean, you mentioned the helpline, or how are you thinking about dealing with the lung cancer issue in Oklahoma?
So there's some amazing things happening right now. The Oklahoma Hospital Association has partnered with some different organizations and have really focused on increasing lung cancer. And Kelly Willingham is kind of heading that up. And she's doing a tremendous job. She jokes that she is really not very fun at parties because she's so focused on lung cancer screening. Right. But, just really getting the message out there. And I love that you brought up, the screening rates and ages and guidelines are so important because it does reach the greater population. But if you are concerned and you do have, talk to your doctor. There are, the screening guidelines for colorectal cancer are, they were 45 when I was supposed to get started. But because of family history, my situation changed. My breast cancer screening, because of my mom, that changed. So remember, the guidelines are just that. They're kind of guidelines, but talk to your doctor always to have the conversation to know what is right for you. And I think that definitely makes a difference in outcomes and confidence in the whole process. And because we don't always know, and we can definitely help more people when they're having those conversations.
Talk a little bit about the work that you're doing with the tribes as well, and the partnership with the tribes, because I think that's an important aspect of cancer mortality and cancer screening and cancer survival here in Oklahoma.
Oh, absolutely. And I absolutely love working with, so Cherokee Nation is the one that we work with the most, because they do have a similar cooperative agreement like we do. They have a cancer plan. And so we partner on so many things. So the Cherokee Nation program is called OSTA, or Oklahoma Strategic Tribal Alliance for Health. And any tribe is really welcome to participate in that, but Cherokee Nation does lead it because of the funding. But they are also focusing on how to improve rates for tribal members and anyone within their jurisdiction. They have some great things going on. They have the same primary prevention, screening and early detection, and survivorship that we do. They have some really strong just events and things that are built within the tribe to get members involved, and some things that have been really fun to really work on, and they've had the grant the same amount of time that we have. And so it's just kind of been, we've partnered through the whole way. Chickasaw Nation and Choctaw Nation, they're also members of the Oklahoma Coalition as well. And so we partner with them. We look at ways that we can help support maybe nutritional pieces for elders who have nutritional resources but have also had cancer. So how can we increase some of that stuff?
So if somebody's not a member of the Cherokee tribe, then they would access some of the resources and things that we've talked about that the state Oklahoma Cancer Coalition.
They definitely could. They could access perhaps whatever is in, under their tribal, medical and health system. We will always kind of connect people as we can. We want the tribe to have the most leadership within their tribe, obviously, and we just want to be there to support. So we always kind of defer back to, what does your tribe have? Let's look. Or maybe they don't live in the tribal area, so it's harder to access. Okay, where can we kind of connect you so it's easiest for you? But, always defer back to the tribe so that they have the biggest say, but what's going to work the best for everyone.
Okay. So I want to close out today. We've talked about prevention, we've talked about screening, but survivorship is kind of this third leg of the stool. So talk a little bit about the importance of survivorship and how you think about it and how patients can think about it, and then what are some of the initiatives and programs that the Cancer Coalition is offering? Okay,
yeah, great question. So we have survivorship kind of divided into two areas. We have adult survivorship, but we also have the children and young adult survivorship piece. And that one has really grown so close to my heart because there's so many things that we're learning through this process. With adult survivors, we have the sessions that, we've kicked off and are focusing on. And they do have kind of the post-treatment fear of recurrence and that kind of thing. So we always want to address that. But with the childhood and young adult cancers, it's so much bigger. So understanding, how whatever treatment a child had if they had cancer is going to impact their entire life, whether it was radiation to the chest and then, how that could impact them later on. We are also working with an organization, it's a national organization called Worth the Wait, and they are actually looking at how to provide education on reproductive rights.
Okay.
So an 8-year-old that is diagnosed with a cancer, they don't have, you're starting treatment that day or the next day. You're not thinking about the reproductive rights of your child later on. But that's going to be important to them later on, and you want them to have that later on. And so how do we look at research and what can we do and so there actually are organizations that are focusing on that, and we're trying to provide that education in Oklahoma as well. So those kinds of things have been just incredible to be able to learn. And we are hoping in September that we will kick off an event for Childhood Cancer Awareness Month that will be just, whether it's a day or a month long like we're doing now. But how can we help parents and the children and even young adults who are post-childhood cancer treatment, but now they're starting to think about building a family and the long-term effects. So we're really working on that as well and very excited to see where that goes.
Yeah. And what's your message for survivors that are coming from rural areas? Because one of the things that's challenging is getting to follow up appointments. And, you mentioned some of the smaller towns in Oklahoma, and a lot of those patients are having to come to Oklahoma City or Tulsa to access particular treatments. How should patients in rural areas think about survivorship and follow-up?
Access what is available to you, whether it's at the library or whether it's online. If there's a telehealth, I know we're seeing, and soon coming, the Rural Transformation Project that is going to happen. And I really believe it is going to change the outcomes for rural Oklahoma because of the people involved and because of the opportunities that I think it's going to give. So I foresee that becoming just even stronger. But access your local networks, whether it's at church or the library or online. When you see series like we're providing right now, make sure you connect. And the great thing is these type of series aren't one health system specific.
Right.
So you're getting to connect with people from all across the state and see how they're handling it. So, just see what's out there, talk to the American Cancer Society, go online, have conversations, and just really kind of start that for you.
I think that's a good point, is that there's a lot of resources that are available online. And there's a lot of great community groups, even on social media or other platforms. Reddit is actually another one where a lot of people get on and talk about the experiences they're going through during treatment and then post-treatment. So just to wrap up, are there any, two things. So tell me about a patient that you've worked with, because you have some incredible patient volunteers that work with the Cancer Coalition. Tell me about a patient story that's really impacted you personally.
Oh, that's such a great question. Wow. One of them, and she didn't actually become a patient, which makes me so excited, but she was a young mother in her late 20s, and she lived in rural Oklahoma.
Okay.
She had lost her father to colon cancer at a very young age himself. She had a positive FIT test, and she was terrified. Yep. She didn't have insurance. She had actually just got her green card. So she didn't, the typical routes that we would send her for the financial assistance weren't available for her as well. And so she reached out and, just like I said, terrified that, what am I going to do? I can't pay out of pocket. I can't leave my kid behind. And so we were able to make some connections, and she was able to access a clinic and get an actual colonoscopy. And she just messaged me and said, it was clean.
Oh, that's
Everything
amazing.
was clean.
Yeah.
And I'm so excited, and I wouldn't have found it without you.
Yeah.
And, and I'm just lucky to be in the position that I know people. It's definitely not me. I just know who to ask.
Yeah.
But for her to know that she has the confidence of, I'm going to get to stay with my kid was amazing to me.
Yeah, sometimes those clean scans are the best thing in the world.
Yes.
And just having that peace of mind.
It is absolutely all about the hope that you can provide to someone.
So if somebody is looking for that type of help, how do they get a hold of you or of a coordinator or caretaker?
Yeah. The easiest way to reach us is probably just through our email, and it's occn@health.ok.gov.
Yeah.
So, and they can, I believe if you kind of type in Oklahoma Comprehensive Cancer Network in a search, we're going to be the first option as well.
Yeah. So OCCN, Oklahoma Comprehensive Cancer Network.
Yep.
That's the name that people should remember. And there is so many resources out
Absolutely.
there on that website.
And if you can't find the resource, you email me through that OCCN website or email, and I will absolutely do everything I can to help.
Yeah. Well, thank you so much for your time,
Yes,
Jennifer.
thank you.
This was great, and I'm really excited to get all of this information out published online so people can I know there's a lot of people out there that are going to appreciate watching or listening to this episode. And again, you guys are doing great work and really appreciate everything you're doing personally and the team that you guys have assembled there at the OCCN. It's fantastic. It's great for the state. So thank you.
Thank you.
Yeah.